Hi, I am Dr. Chaithanya KS. I am a board certified Ayurvedic practitioner. I graduated from Rajiv Gandhi University of Health Sciences. Currently, I practice in Bangalore. Psoriasis is one of the diseases where people approach Ayurvedic doctor for their treatment. Generally, they approach Ayurvedic doctor because of the side effects of the modern drugs, or maybe the relapse of the psoriasis very frequently, or not getting the proper results while doing the treatment. So when we look about the causative factors why the psoriasis starts, there are various reasons which Ayurveda explains, basically concentrating on the dietetics, maybe the food and lifestyle, and other factors such as environmental factors and many other things. So basically when we look into the reason why the psoriasis starts, we can find mainly the changes in the dietary factors which majorly influence the initiation of the psoriasis. There are other reasons why it starts, like changes in the cellular functions or consumption of certain food which may act against our own body. So these are the common reasons why the psoriasis can start in a person. So regarding treatment, the first line of treatment in Ayurveda generally lies the avoiding the causative factors. Identification of the causative factors and avoiding them is one of the basic line of the treatment. Then depending on the dosha predominance, so we do treatment accordingly. The psoriasis treatment, it's not a common treatment for all the patients who has the psoriasis. Ayurvedic treatments are individualized. It depends on person's body's nature and the dosha predominance and the severity of the disease. It can vary person to person. Generally, Ayurvedic treatment starts with the dietary changes along with the certain medications. If the disease is too severe, then one may have to undergo detoxification procedures, which are basically to cleanse the body and purify the body so that the next set of medications can work much effectively, so that it can correct or balance the doshas which are imbalanced earlier. So not only stop the treatment here, we also look for the preventive measures where psoriasis is known for its reoccurrence due to various influencing factors. We also give certain medication which will help to prevent the reoccurrence of the psoriasis, so that one can minimize the reoccurrence or one can prevent the further progression of the disease during the course of treatment.